Fentanyl. Expanded lecture notes. Why fentanyl is important. Do you want to know more about fentanyl's clinical use, risks, or its role in the opioid crisis? Introduction. 1. Fentanyl is a potent synthetic opioid analgesic widely used in anesthesia, ICU, and emergency medicine for pain control, sedation, and adjunct to anesthesia. 2. It is about 50 to 100 times more potent than morphine and is favored its rapid onset and short duration after a single dose. 3. Its high lipid solubility allows quick CNS penetration, making it ideal for induction and rapid analgesia. Definition. Fentanyl is a synthetic phenylpiperidine opioid agonist at the mu-opioid receptor, producing potent analgesia, sedation, and respiratory depression. Fentanyl acts on mu-opioid receptors, causes pain relief, sedation, and slowed breathing. High potency, strong effects compared to other opioids. Fentanyl classifications. 1. Pharmacological class. Opioid analgesic. Acts like other opioids to relieve pain. 2. Therapeutic class. Narcotic analgesic. Used medically for strong pain relief. 3. Controlled status. Schedule II in most countries, due to high abuse potential. Strictly controlled because of risk of abuse and dependence. Chemical properties of fentanyl. 1. Chemical name. N-phenyl N,1,2-phenylethyl-4-piperidinal propanamide, describes fentanyl's chemical structure. 2. Molecular formula. CHNO, shows atoms making up fentanyl. 3. Molecular weight. 336.47 grams per mole, fentanyl's mass. 4. Structure. Synthetic piperidine derivative. Fentanyl is man-made with a specific chemical setup. 5. pKa approximately 8.4. Indicates how fentanyl behaves in different pH, acid-base conditions, affects how it works in the body. Physical properties. 1. Appearance. Clear, colorless solution, injectable. 2. Solubility. Highly lipophilic, soluble in water when formulated. 3. Formulations. Injectable solution, various strengths, transdermal pats, lozenges, buccal tablets, nasal spray. 4. Stability. Stable at room temperature, protect from light. Mechanism of action. 1. Potent mu-opioid receptor agonist in the CNS and spinal cord. 2. Inhibits ascending pain pathways, alters pain perception, and increases pain threshold. 3. Causes neuronal hyperpolarization by increased potassium efflux and reducing calcium influx, thus inhibiting neurotransmitter release. Fentanyl acts on mu-opioid receptors in brain and spinal cord, blocks pain signals, changes how pain is perceived, and raises pain threshold. Calm neurons by affecting ion flow, stopping them from releasing signals. Pharmacokinetics. 1. Absorption. Rapid after IV administration. Transdermal and transmucosal routes also effective. 2. Distribution. Highly lipophilic results in rapid CNS penetration results in fast onset. 3. Protein binding. Approximately 80 to 85%. 4. Metabolism. Hepatic via 3 cypriot pounds A4 to inactive metabolites. 5. Elimination. Primarily renal metabolites. 6. Half-life. 3 to 12 hours. Context-sensitive half-life increases with prolonged infusion. Pharmacodynamics. 1. Onset IV 1 to 2 minutes. 2. Peak effect 3 to 5 minutes. 3. Duration bolus 30 to 60 minutes. 4. Effects. Analgesia, sedation, euphoria, respiratory depression, bradycardia, mild hypotension. Fentanyl clinical uses. 1. Analgesia during and after surgery. 2. Adjunct to induction and maintenance of anesthesia. 3. Analgesia in ICU patients mechanically ventilated. 4. Acute severe pain, trauma, burns, myocardial infarction. 5. Procedural sedation in adults and children. 6. Chronic pain management via transdermal patches or transmucosal forms. Fentanyl use in ICU. 1. Continuous infusion for analgesia in ventilated patients. Continuous infusion for analgesia in ventilated patients gives pain relief to patients on breathing machines. 2. Opioid of choice in patients with hemodynamic instability, less histamine release compared to morphine. Opioid choice in hemodynamic instability. Fentanyl is safer for patients with unstable blood pressure, releases less histamine than morphine. 3. Useful in patients with renal impairment, no active metabolites. Useful in renal impairment. Fentanyl doesn't have active metabolites that build up in kidney problems. 4. Adjunct to sedation with benzodiazepines or propofol. Adjunct to sedation. Used with other sedatives like benzodiazepines or propofol for more effect. Fentanyl use in anesthesia. 1. Induction. Provides analgesia and blunts sympathetic response to laryngoscopy and intubation. Fentanyl helps with pain relief and reduces body's stress response during tube placement. 2. Maintenance. Reduces requirement for inhalational anesthetics. Fentanyl lowers the amount of breathing gases needed for anesthesia. 3. Balanced anesthesia technique, combined with sedatives or hypnotics. Fentanyl used with other drugs for a complete anesthesia effect. Fentanyl use in emergencies. 1. Rapid analgesia for severe acute pain, trauma, burns. Fentanyl quick pain relief for trauma or burns. 2. Analgesia during pre-hospital or emergency intubation. Fentanyl helps with pain during urgent tube placement. 3. Used in rapid sequence induction to blunt sympathetic responses. Fentanyl reduces stress response during rapid intubation. 4. Control of pain in myocardial infarction. Fentanyl manages pain in myocardial infarction. Administration and dosage. 1. IV bolus analgesia 25-100 micrograms every 30 to 60 minutes as needed. 2. Induction adjunct 2 to 20 microgram per kilogram IV bolus, higher doses in cardiac surgery. ICU infusion 1 to 3 microgram per kilogram per hour, titrate to effect. 4. Transdermal patch 12 to 100 microgram per hour for chronic pain, replace every 72 hours. 5. Transmucosal. Dose individualized commonly for breakthrough cancer pain. Side effects. 1. Respiratory depression. 2. Bradycardia. 3. Mild hypotension. 4. Sedation, drowsiness. 5. Nausea, vomiting. 6. Constipation. 7. Muscle rigidity, especially chest wall rigidity with rapid high-dose IV bolus. Serious side effects of fentanyl. 1. Severe respiratory depression leading to apnea, can slow or stop breathing. 2. Chest wall rigidity leading to impaired ventilation. Muscle stiffness in chest can make breathing hard. 3. Anaphylaxis, rare, ear, life-threatening allergic reaction. 4. Seizure-like activity, rare, uncommon abnormal brain activity. 5. Profound bradycardia or cardiac arrest, rare, high-dose, very slow heart rate or heart stops, with high doses. Contraindications of fentanyl. 1. Hypersensitivity to fentanyl or opioids. Don't use if allergic to fentanyl or similar drugs. 2. Severe respiratory depression without support. Not for patients with bad breathing issues unless on a ventilator. 3. Acute, severe asthma in unmonitored settings. Risky in severe asthma without close watch. 4. Paralytic ileus for transdermal oral forms, not for patients with severe gut paralysis using patches or oral forms. Precautions. Precautions with fentanyl. 1. Elderly or debilitated patients, reduce dose. They're more sensitive. 2. Hepatic impairment, reduced metabolism. Liver problems slow down fentanyl breakdown. 3. Concomitant CNS depressants, additive sedation. Adds to sleepiness and effects of other sedatives. 4. Tolerance and physical dependence with prolonged use. Body adapts, needing more for effect, can be physically dependent. 5. Risk of opioid-induced hyperalgesia with long high-dose use. High doses long-term might increase pain sensitivity. Advantages of fentanyl. 1. Rapid onset and short duration after bolus. Works fast and wears off quickly after a dose. 2. Minimal histamine release, less hypotension than morphine. Less likely to cause low blood pressure versus morphine. 3. Thin renal impairment, inactive metabolites. No active metabolites build up in kidney problems. 4. Multiple routes of administration. Can be given in different ways, IV, patch, etc. Disadvantages of fentanyl. 1. High potency increases risk of overdose. Very strong, so dosing errors can cause overdose. 2. Accumulation with prolonged infusion leading to delayed recovery. Can build up in body, causing delayed recovery after stopping. 3. Risk of chest wall rigidity. Can cause muscle stiffness in chest, affecting breathing. 4. No intrinsic anti-inflammatory effect. Only helps with pain, not swelling or inflammation. Clinical considerations. 1. Always monitor respiratory status and oxygenation during administration. 2. Administer slowly IV to reduce risk of chest wall rigidity. 3. Use in combination with sedatives in ICU to optimize comfort and reduce delirium risk. 4. Titrate to effect. Avoid fixed high doses unless clinically indicated. 5. Have naloxone available for reversal of opioid toxicity. Comparison of fentanyl with other opioids. Onset, IV. Fentanyl, remifentanil. Super fast, 1-2 minutes, 1 minute. Morphine, hydromorphone. Slower start, 5-10 minutes. Duration. Fentanyl, 30 to 60 minutes. Remifentanil, very short, 5-10 minutes. Morphine, hydromorphone. Longer, 3 to 4 hours, 2 to 4 hours. Histamine release. Fentanyl, remifentanil, hydromorphone. Minimal. Morphine. Releases histamine, can cause low BP. Potency versus morphine. Fentanyl, remifentanil. Approximately 100 times stronger. Hydromorphone. Approximately 7 times stronger. Renal impairment. Fentanyl, remifentanil, hydromorphone. Safer. Morphine. Use with caution. Additional information. 1. Context-sensitive half-life increases with prolonged infusions, up to several hours, unlike remifentanil. 2. Chest wall rigidity is a unique high-dose rapid bolus phenomenon, reversed by muscle relaxants or naloxone. 3. Transdermal fentanyl is intended for opioid-tolerant chronic pain patients, not for acute pain. Current trends. 1. Still the main opioid in cardiac anesthesia and ICU sedation analgesia protocols. 2. Increasing use of shorter-acting opioids, like remifentanil, for fast recovery cases. 3. Concern over fentanyl abuse and overdose deaths outside the hospital setting, leading to tighter regulation. Conclusion. 1. Fentanyl is a cornerstone opioid in modern anesthesia and ICU practice due to its potency, rapid onset, and cardiovascular stability. 2. However, its high potency and potential for accumulation require careful dosing, vigilant monitoring, and awareness of respiratory depression risks. Fentanyl is the scalpel of analgesia, precise, powerful, and demanding respect from the one who wields it. According to anesthesia's safety principle, fentanyl is like a surgical scalpel in pain management. It's precise, super powerful, and demands respect from whoever uses it. Thank you for watching. If you liked this content, don't forget to like to show your support. Comment and share your thoughts. Share with your friends and family. Subscribe for more exciting content. Your engagement means the world to us. Stay tuned for more.